Hello everyone, my name is Connie. I'm an emotional release therapy student under training, and I'm also my mentor, Dr. Bao's promoter and spokeswoman in the United States. Today, we feel very honored to invite Dr. Melissa Yee as our guest to talk about her experience with Dr. Bao's workshop and his emotional release therapy. Dr. Melissa Yee grew up and currently lives in Hawaii. She's lived and traveled extensively in Europe and Asia to follow a lot of masters and teachers, including Dr. Bao Fengyuan and his emotional release therapy. And she has a doctorate degree in acupuncture and a Chinese medicine degree at the Oriental Medicine Institute and the University of Health Science in Hawaii. Okay, hello, Dr. Melissa. Now let's, I'm very curious about how did you know about Dr. Bao and his therapy?
Hi, Connie. I'm very honored to be here today.
Mm-hmm.
I went to China in, I think it was 2014, the first time.
Wow.
And it was a health tour.
Mm-hmm.
So I went there with about 9 other people who had gone the previous year.
Mm-hmm.
And it was a similar tour. We went to a Taoist monastery. We were in Shanghai, Beijing.
Mm-hmm.
And part of the Beijing tour was to visit the Tai Chi master. I don't remember his name right now, but we were at his center and Master Bao came to do a class there. So I really knew nothing about him.
Mm-hmm.
But it was quite fascinating to see his slides and all the different people that he had treated. So I sat in the front row and I was really excited to learn what he had to say.
I see. Wow. That's kind of really interesting trip that you happened to meet Dr. Bao on your trip in China.
Yeah, I was so fortunate, because as I said, I sat in the front row and I wanted to learn what he had to share. And he just picked me out of the group the first day.
Mm-hmm.
And he said, "Oh, you have to forgive somebody." And I looked at him like, how can you see that? And I started to panic because I thought, how does he know?
Mm-hmm.
And it was a situation that was weighing very heavily on me. Actually, I gave you the wrong year. It was 2017 that I went to China the first time.
Yeah.
So I had an incident in 2016 when I went to Japan, and something quite terrible happened there that was really weighing on me. So when I met him in 2017, I was really surprised to see that he picked up on that.
Mm-hmm. Mm-hmm. I see. Because I think I remember there's a video about Dr. Bao applying the emotional release therapy on you.
Right.
I'm not sure if that is the one you were talking about, but just help you to release some emotions. Yeah. Mm-hmm.
Yeah, it was really affecting me, and I thought I had processed it doing other methods.
Uh-huh.
But when he picked up on it right away, I was just so shocked, and I said, well, do I dare say the person's name? Do I dare say what's really going on? And I said, just let it go. It's time to let it go because he can help you. Mm-hmm. So I got up in front of the class and I just let it all out. I didn't want to hold back because I didn't want to drag that around anymore.
I see. Yes, Dr. Bao is kind of a genius at reading people. Sometimes can really, you're really shocked when he asks you questions like,
exactly.
How did he know?
Yeah, exactly. So I said, let's just go with it. I don't really believe this. I don't know what he's doing to me, but I'll just follow his instruction. And I did. And I got a lot out of it. And the other people who were in the class, there was one girl who actually moved to the back of the class because she had a similar incident happen in her childhood. But she didn't want to let it go. So, she had to move away because it was too traumatic and too confrontative for her.
Yeah. It's really good for you that you are ready and you're ready to open up yourself and let it go. It's very important for this
Yeah.
therapy to really work on you and take effect. Yeah, and so what did you experience after the therapy? Like you said, it transformed your life. Yeah, just curious.
Yeah, my feeling immediately was that I was a lot lighter and relieved that I was able to let it go.
Mm-hmm.
And I told him that evening when we had a gathering, you know,
Mm-hmm.
that I could feel already that it had transformed my life, because I've done a lot of work on myself, because I do help people myself. So all
Yeah.
the things that I learned, I can apply to my patients and clients.
Mm-hmm.
And with this therapy, I felt that because he could target the issue so quickly and address it in a method that was not going to take years and months and, you know, a lot of crying and pain and
Yeah.
too much self-reflection that resulted in nothing.
Mm-hmm.
I was so grateful that we could process me so quickly. So I've used it already from the little that I know to help other people. And,
Mm-hmm.
you know, it's really a matter of targeting the original
Yeah.
event, which
Yeah.
goes back to one's childhood.
Yeah. Yeah. That this therapy enable you to trace back in someone's early childhood memory and just catch that incident, like the emotional cell memory, emotional root, and you just clear it and you release the emotion, clog the blocked energies, and okay, works down.
Yeah.
The
The interesting thing is that you think of that it's this incident, you know, that this happened to me recently, but I was able to go inwards and realize that it was something that went all the way back to my childhood and had to do with my relationship with my mother.
yeah.
So to have that kind of insight so quickly, maybe it was because I was willing, but to have it be a pattern that was so ingrained was amazing to me, you know, because I know I've studied psychology and I never found it effective to relieve whatever was going on with the person, whether
Mhm.
myself or with the patient.
Yeah, I remember that watch that short video clip. It's about you releasing your emotions that and with your mother, like when you were very, very little. Yeah, so that is kind of he started with your current current thing, the incident in Japan, and then traced back and find the roots. It's when you were like 1 year old. Okay.
Yeah.
Wow, I see. And you said although you studied and worked in this area, but you haven't seen such a fast, quick, effective therapy method to help people.
Yeah, absolutely.
Mhm.
Actually, you know, if you're willing to work on yourself,
Mhm.
any kind of method can help.
Yeah.
It's kind of like layers of the onion. They always use that metaphor, that you peel away one thing and then there's something else
Yeah.
underneath. But to target that original event is what is most effective about emotional release therapy.
Yeah. Yeah. I totally agree. I feel the same way. And so when you apply this technique in your work, like with your clients, like what do you observe and so what do you observe in your work that bring like a difference, or what's your clients' feedback?
Um, I'm a doctor of acupuncture and Chinese medicine, so
Mm-hmm.
I have about 30 years of experience, and I've used all the other methods I've learned along the way to help individualize what the person needs. And in some cases, some people just don't want to talk about their emotions. You know, they just want to relieve pain, and they may or may not open,
Mm.
but it takes a little bit of time to gain the person's trust. And once I've done that, then they're actually willing to go to that place, to that event that really is stuck in them. And with those people, they want to get results. One person in particular, I have a patient who she has a fear of driving, so her husband, her daughter have to drive her
Mm.
because she had that that
Wow.
experience a couple years ago. And through knowing Master Bao's therapy, I pinpointed it pretty quickly because she's been going to a social worker for a long time and kind of talking around her issues and been able to uncover some of the things that contribute to her blockages.
Mm-hmm.
But this one time that I was sat with her, you know, we just zeroed right in on the fact that it went back to when her father died, when she was a teenager.
Mm-hmm.
And he was supposed to come home, but he never came home. And so she described the event where she was waiting in her front yard for her mother to come back because the priest had come to take the mother away. And she knew right away that it had something to do with the father not coming home. And so actually her fear of driving is something that goes all the way back to that time where
I see.
he was driving. She knew something was up when he didn't come home. And then she's working on it. But I have to proceed slowly because a lot of people really don't want to start screaming and crying. You know, they're holding their emotions in so tightly that to take her to that place right away would be a little bit too hard for her. But she told me she's ready to come back and do what needs to be done because now she has to drive herself. She doesn't have people to help her. So she has to drive. So she's going to have to confront it, and I'll be seeing her pretty soon.
Okay, yeah.
Couple of weeks.
Wow, that sounds really amazing. Yeah, it's she knows the issue, and you just wait a little bit when she's ready, and you do it. Yeah, it's also something I heard about some of Dr. Bao students saying that sometimes you need to educate your clients a little bit about this therapy. How does it work? And need to give them a little bit of time, and they can trust you and this therapy. And then when they are ready to open up, because I feel for a lot of therapies, it's partly depends on the therapist, the experience partly depends on the client if they are ready to open up, and it would affect how well the therapy goes, how well they can get healed.
Yeah, and it's been my experience in the 30 plus years that I've been learning and treating people.
Mm-hmm.
That you have to combine the body work, the hands-on therapy, with talking to the person, because I know that the trauma or the memory is locked into the muscle. So by doing psychology on somebody and just talking to them, okay, they can intellectually identify with the event, but they can't release it. So when they get acupuncture, when they get body work, when you put your hand or hands on the acupressure points or the muscle that's so tight with the memory, the PTSD of the event, then they can release it. And so the combination of hands-on and talking to them in a way that allows them to release it, oftentimes permanently, that to me is the most effective of all the different therapies I've learned. Not only Master Bao's therapy, but others that come near to that, you know, where you touch the muscle and then you stay there and you allow the person to talk it out and release it.
Yeah, totally agree. I heard some therapists talking about the body work, that touching, that our muscles just have hold those emotions, those traumas there, and you're touching it by talking, combine them together, and it can work well. Yeah, it's really great that you can combine all of you learned from like psychology and acupuncture, Chinese medicine, and body work and Dr. Bao stuff together to help your client to recover from mental, physical problems.
Yeah. I wish she had more books in English, and I also wish she could speak English. Because it would be a lot easier for us. I mean, I would love to go to China to learn directly from him, but the situation in the world right now is difficult. So whether he comes here or I go there, you know, remains to be seen. But I found the few times that I've been with him in workshops that they have been so profound. And I'm so appreciative of what I've learned so far.
I still agree with you. Yeah, just Yeah, I think he has one book published already, and he said later this year, he will have another book published in English, and hopefully,
Okay.
yeah, that will be great news that the books can deliver more of his knowledge and his experience with people. Yeah, and I agree with you. I thought about going back to China this summer to attend his workshop. Yeah, but the whole situation just does not give me a chance to go back. So yeah,
Yeah.
and yeah, it's really a little bit complicated, and I hope he could come back to teach. And he's taught online teaching through some podcasting Chinese apps this year, and then he started the telehealth consultation, like for several months, from like maybe March um, to late May and early June, just stopped and just help a lot of people. Just he does not need to meet client in person, just talk them just through the podcast, the audios and this telehealth, and just talk and just kind of nail down what's in their past may like blocked them, like it's like showed up at their current physical problem. And he even did a little bit like emotional release therapy through online, not a lot, but a little bit, help those people release a little bit emotions. And some clients' feedback is pretty, yeah, so I feel he's really, really powerful and a great healers and a therapist. Yeah.
Yeah, I think that's the amazing thing about this telemedicine, that most of us never did Zoom before, and we thought, well, it's, you're not going to have that hands-on, face-to-face,
Yeah.
full body communication.
Yeah.
But it's amazing how much you can pick up through that TV screen.
Yeah.
And just by looking at the face, you can already read a lot of the features and the way the person talks and moves. So with Master Bao's skills, of course, he can't touch them, but he definitely can pick up on their energy field.
Yeah, yeah, definitely. Yeah, I know this year a lot of therapists, they try to turn to telehealth and they learn how to use those online techniques, try to keep their business working. It's pretty tough, but still could work to some extent.
Yeah, I think it can be utilized a lot more in the future, and that's very promising.
Yeah, I feel it could be a trend. Yeah.
Because it will become more difficult to travel. So this may be our only choice for a while.
Yeah, yeah. At least I feel for now and maybe the next 3 months, maybe I don't know the whole year, but I'm not super positive.
Right.
Yeah, and yeah, just yeah, thank you so much, and for like today you talk about your experience with Dr. Bao and his workshop, and I have one more question. It's like when you're in his workshop, how do you like it? Like how does it organized? What just make you feel you like? How do you like the way the workshop is conducted?
He's very versatile. I remember when we were in China that first we started in a classroom situation, and then we moved to the treatment rooms. It was a little difficult, when he's standing over somebody to see exactly what he's doing. But even with the workshops that we had in Baltimore, if you really wanted to watch and know, there were many assistants who helped show you the points. The only disadvantage was the translation. So,
Yeah.
for us who are not Chinese speaking, it takes longer time to grasp. And if you're not already doing something like psychology or body work, you're just pretty much an observer, so it'll take a while for you to absorb what he's trying to show us. Like my friend who is a retired medical doctor, she was very fascinated by what she saw, but because she doesn't really touch people the way I've learned to as a body worker, it was harder for her to translate her understanding in that short time into something she could apply to anybody she needs. But for me, even the talking, the one-on-one exchange was very beneficial because I learned different ways I could speak to a person without saying too much, without pushing them, just allowing them to open up on their own and share what they wanted to share. So I think the more people practice, obviously, they'll get better at it. And so if he could do online workshops, with somebody translating, that would make it a lot easier for everybody.
Yeah, I was thinking about that too. I think I will try to talk to Dr. Bao, like with me and some of his students who has good English skills. We translate. Maybe he can do some online workshops, like teaching the theories, like just some basics. But I feel definitely when you observe in the workshop, when you experience like face-to-face or experience by yourself, it would be more impressive and easier to understand. But I feel online workshop or online webinar could be a choice. Yeah, I think I will try to talk to him to see if there is a possibility to do that.
I think going forward, that's really the only way we can do, because the cost of traveling overseas, the visas, and now the hesitancy with all these virus epidemics, whatever, and people being very suspicious of each other, it's going the opposite direction, isn't it? So we have to find another way, and obviously people who cannot travel, they can still learn through webinars. So if he would be willing to do that, I would be more than happy to join those.
Yeah, I feel it could be easier because nowadays I try to follow some like social media, like marketing or something. I learned from some masters and some people who are good at it. They all talk about a lot of people just move their business online. Like a lot of therapists, coaches, life coaches, teachers, they just start teaching things online. So yeah, that's an option. I definitely would deliver the message to Dr. Bao. And also agree with you that for people who has experience with body work or holistic therapy kind of things, would be easier for them to understand what Dr. Bao was doing. And also agree with you because I heard some of his students say that it's important to practice. The more you practice, the better you would master the course of this therapy, and easier for you to move on to help more people.
Yeah, it's always a matter of being committed and being willing to do it. For us here in Hawaii, there were many young students who, because my sister is a preschool teacher, she said the kids would just show up for attendance, but they wouldn't do the classwork or the homework because they knew it didn't really count. Unfortunately, this is the reality, that we are going to be communicating more by computer. We would love to get back to face-to-face contact. But if you're really willing to learn, if I was willing to go all the way from Hawaii to China and from Hawaii to the East Coast, it's because I really wanted to learn. And this has kind of been an obstacle, the last 4 months where we were locked down and couldn't go anywhere. But the alternative would have been to do online webinars. So I do ask Master Bao to consider that in the future, because he may not be coming to Hawaii or America for a while.
Yeah, it's a very, very realistic issues with you. And thank you so much for reminding me of this inspiring information. I will definitely talk with Dr. Bao. And also thank you so much for having the time with me today on the interview, sharing all your experience, your thoughts, and everything about about Dr. Bao and his workshop, his emotional release therapy. Just thank you so much.
You're very welcome. It's really been my pleasure to get to know him and the people who have been in the workshops. So I really look forward to learning more in the future, and of course incorporating more of his methods into my own work.